mental health remains a pressing issue in France. In 2022, over 8,000 patients were still subjected to restraint and isolation in psychiatric care. Despite advances in science, these practices, often justified as therapeutic, continue to spark intense debate. What does this mean for patients, for psychiatry, and for the broader society? Let's take Philippa Mota recounts her story from 20 years ago. During a manic episode, she was forcibly restrained and locked in a room without clear explanations. Her testimony, filled with fear and trauma, highlights how brutal and dehumanizing these methods can feel to patients. She describes the terror of being restrained with leather belts, the fear, the helplessness, the sense of being punished rather than cared for. This trauma continued to shape her reactions during later hospitalizations, leaving long-lasting scars. Years later, Philippa transformed her experience into advocacy. She wrote a book, Et c'est moi qu'on enferme, and now works as a mental health trainer in companies. Her mission? To shed light on why such practices should no longer have a place in modern psychiatry. Experts like psychiatrist Hugo Baup agree. He stresses that isolation and restraint have never shown proven clinical benefits. Despite being presented as care, no scientific evidence confirms they help patients recover from bipolar or. In June, many psychiatrists signed a manifesto calling for the abolition of these methods. This movement reflects a broader trend in psychiatry to shift from coercion, yet the practice persists. Official statistics show that in 2022 alone, more than 100,000 measures of isolation and restraint were still applied in France. Hospitals justify them as necessary for safety, but critics argue they reflect systemic shortcomings, lack of staff, outdated infrastructure, and insufficient therapeutic alternatives. International comparisons make the French situation stand out. In some northern European countries, restraint is nearly abolished, thanks to alternative approaches like de-escalation rooms and intensive psychological support. Reformers argue France should learn from these examples to align with modern, rights-based psychiatry. Ultimately, the debate over restraint and isolation is about the future of psychiatry in France. Should treatment rely on coercion or on building trust and human dignity? The answer will shape not only patient outcomes, but also society's vision of mental health in the 21st